Dr. Jekyll and Mr. Hyde film assignment by Sarah Hollenbeck. Dr. Jekyll is the main character from the movie Dr. Jekyll and Mr. Hyde. He is a doctor in London that has an innate belief that every person has both good and bad impulses. He creates a drug that he believes will help bring out his dark side, which is ultimately his persona, Mr. Hyde. Dr. Jekyll should be diagnosed with the dissociative identity disorder. Dissociative identity disorder is a disorder in which a person has more than one personality. In the case of Dr. Jekyll and Mr. Hyde, he has Dr. Jekyll, which is considered his good side, and his dark side, which is considered Mr. Hyde. His diagnosis would fall into the dissociative disorders category of DSM-V. Two symptoms that Dr. Jekyll has to correlate with dissociative identity disorder are Dr. Jekyll believing that he physically changes and each of his personas having distinctly different behaviors. An example of him believing he physically changes is when no one recognizes that Mr. Hyde is actually Dr. Jekyll. An example of their personalities being very different is evident in their interactions with Ivy. Dr. Jekyll saved Ivy from a mugging, whereas Mr. Hyde forced her into unwanted sexual interactions. One symptom of dissociative identity disorder that Dr. Jekyll does not present are out-of-body experiences. Though he believes Hyde is controlling him, he still sees the world from Hyde's point of view. He does not believe that he is out of his body looking down on someone else. The recommended treatment for Dr. Jekyll would be therapy. Though many types could be helpful, I would specifically recommend psychotherapy. Though therapy can be helpful, this disorder will never be cured, and Dr. Jekyll will have to fight anxiety and depression most likely for the rest of his life. Though the outcome is not the best, it is recommended because it should help his Mr. Hyde calm down some and become less violent. The only real ethical concern about this kind of treatment is whether it is worth it, because there is a chance that the therapy could just bring out his Mr. Hyde side even more. In the film Dr. Jekyll and Mr. Hyde, dissociative identity disorder is not portrayed very accurately. This is due to the fact that in real life, the personality does not come out by drinking a concoction. In addition to that, the movie is not accurate because it portrays Mr. Hyde looking physically different to the outside world. Though people with disorder may believe that they look differently, the outside world views all their personas to have the same physical features. Thank you.